A very good day to the examiners. We hope that you are doing fine. We are from Group 5, consists of Imelda, Ivy, Joyner, Leonard and myself, Jackson, and we will be presenting on Albert Bandura three process of social learning or cognitive theory and how this approach could influence nursing practice and patient care. We do hope that you enjoyed this presentation and could hear some feedback from you. Thank you for your support and feedback.
A good day to the examiners. My name is Imildalikan Anakbuan. My metric number is 75040. Today, I'm gonna explain about Introduction to Albert Bandura Theory, Social Learning Theory or Cognitive Theory, and then the three process of Albert Bandura Theory.
Firstly, let me introduce to you guys who is this before we go deep into the three process of social learning or cognitive theory. He is Dr. Albert Bandura. His famous profession is Stanford Psychology Professor. He is the one who introduced the three process of social learning theory or cognitive theory. The three process that had been introduced by him is mostly focusing on the production of behavior. The process is also known as a frame for understanding how people are shaped by their actions and social environment around them. Before he came up with the three process, he introduced social learning theory first and then followed by social cognitive theory. The social learning theory was introduced by him in 1977. This theory is focused on observational learning and modeling, which means people learn from one another by observation, imitation, and modeling within the context of social interactions, experiences, and outside media influences. To support his theory, he came out with the triadic reciprocal causation model. The triadic reciprocal causation model shows that the observational learning and modeling in social learning theory can be influenced by behavior of people, personal factors, and environmental factors around them. In 1986, social learning theory is renamed to social cognitive theory. Its emphasis on cognitive or thinking of observational learning and the way of behavior cognition and the environment. He also modified the triadic reciprocal causation model into how to determine human behavior. Human behavior can be determined by cognitive factors, which is focused on knowledge, expectations, and attitudes, while behavioral factors focus on skills, practice, and self-efficiency. And then environmental factors focus on social norms, access in the community, and influence on others and environment. From the social learning or cognitive theory he introduced, he came up with the three process, which is observational learning, modeling, and self-efficacy. The first process is observational learning. There are four steps in observational learning. The first step is attention. You must be focusing on behavior by paying attention to the model. It is a condition for learning. The second step is retention. You must retain it in your memory by remembering what the model did. It is a condition for imitating the model's behavior. The third step is reproduction. You must be capable of copying the behavior, which means people must have capacity for imitating the behavior. And the last step, which is step number 4, is motivation. You must have a reason to imitate the behavior. People must be motivated to imitate the behavior.
That's all for my presentation part, and the next two process will be presented by my colleagues, which is Joy Nisa.
Good day to the examiner. My name is Joyna Christina John ID 75222, and today I will be presenting the next process in Albert Bandura's social learning theory. So, the second process in Albert Bandura's social learning theory is modeling. Model is a thing used as an example to follow or imitate. It can be in the form of things or human beings such as our family, friends, artists, and people surround us. Modeling involves making a representation of something or someone. People learn and change their behavior through modeling. Why remodeling? Remodeling because it helps us to visualize things in life as it is or as we want it to be. We also modeling to permit a specific the structure or behavior of a model. Besides, we also can document the decisions we have made in life, and modeling gives us a template that guides us in constructing our life. According to Bandura, there are three factors most influential in effectiveness of modeling situations. The first one, attributes of the observers. Individuals who are low in self-esteem, dependent, and who lack confidence are not necessarily more likely to be influenced by models. Number two, consequences of the model's actions. People are more influenced by models who are often praised or rewarded than models who are often scolded or fined. Number three, characteristic of the model. Relevant characteristics of an influential model are high status, competence, and power. When observers are unsure about a situation, they rely on cues to indicate what they perceive as evidence of past success by the model. Example of cues: general appearance of the model. Maybe the model is wearing designer clothes and jewelry, and also symbols of socio-economic success. Maybe the model is driving in a fancy sports car. And signs of expertise. Since this model appear to have been successful themselves, it seems logical that observers might want to imitate their behavior. It is important to pick the right model in our life, as modeling leads to positive or negative impact. Examples of positive effects on modeling are change behavior in a positive direction, inspire life, be a guide to do something, and get ideas. On the other hand, negative effects on modeling are change behavior in a bad direction and get the wrong influence. The third process in Albert Bandura's social learning theory is self-efficacy. Self-efficacy refers to an individual's belief in his or her capacity to execute behaviors necessary to produce specific performance attainment. Self-efficacy reflects confidence in the ability to exert control over one's own motivation, behavior, and social environment. People with strong sense of self-efficacy more likely to develop deeper interest in the activities in which they participate. They also form a stronger sense of commitment to their interests and activities. This kind of people recover quickly from setbacks and disappointments. They view challenging problems as tasks to be mastered. People with weak sense of self-efficacy often avoid challenging tasks. This is because they believe that difficult tasks and situations are beyond their capabilities. Besides, this kind of people also focus on personal failings and negative outcomes. They quickly lose confidence in personal abilities. According to Bandura, there are four major sources of self-efficacy. Number one, mastery experiences. Performing a task successfully strengthens our sense of self-efficacy. However, failing to adequately deal with a task or challenge can undermine and weaken self-efficacy. Number two, social modeling. Seeing people similar to oneself succeed by sustained effort raises observers' beliefs that they too possess the capabilities to master comparable activities to succeed. Number three, social persuasion. People can be persuaded to believe that they also have the skills and capability to success. Consider a time when someone gave you a positive and encouraging advices that help you to achieve your goal. Getting verbal encouragement from others help people overcome self-doubt and instead focus on giving their best effort to the task at hand. Number 4. Psychological responses. Moods, emotional states, physical reactions, and stress levels can all impact how a person feels about their personal abilities in a particular situation. For example, when someone gets extremely nervous before their speech in a public, it will make them develop a weak sense of self-efficacy in the situation. There are a few ways in building self-efficacy. Number 1. Celebrate your success. When you succeed at something, you are able to build a powerful belief in your ability. However, if you experience a lot of easy success, you may find yourself giving up more readily when you finally do encounter failure. Number 2. Pay attention to your thought and emotion. If you find yourself getting stressed out or nervous before a challenging event, you might feel less sure of your ability to cope with the task at hand. Therefore, focus is the key. Number 3. Seek positive affirmation. Hearing positive feedback from others can also help improve your sense of self-efficacy. Feedbacks from friends, mentors, and people you respect can make you feel greater confidence in your own ability. Try to avoid asking for feedback from people who you know are more likely to have a negative or critical view of your performance. Number 4. Observe others. Seeing others putting in effort and succeeding as a result can increase your belief in your own ability to succeed. This concludes my section, and now I will transfer you to my teammate Leonard for the next information of this presentation. I do hope you enjoy our presentation and thank you for your support and feedback.
Hi, my name is Leonard Analuang and my matrix number is 75372, and today I'm going to talk about how social learning theory could influence nurses. So, how this approach could influence nurses? The basic factor in social learning theory is learning through observing and modeling others. Since the professional information is detailed and comprehensive in nursing education, it is sometimes difficult to directly transfer the knowledge to the student. According to Bandura, while learning the information by means of modeling, the mutual interactions between the trainer and the learner will contribute to the learner in terms of observing better and being mentally more active. The effectivity of learning is based on the learner's ability to perform the behavior that she or he observed. Being a positive role model to the students gives them to establish therapeutic communications, professional thinking, and giving them a chance to improve their behavioral and attitudinal skills. Positive role model improves the learner's belief and practices toward improving the quality of life of the patients. It contributes to his or her future professional development by supporting the learners combining the theoretical knowledge with practical. The student and the environment are in a mutual relationship. They are affected by each other, and a person learns a behavior by observing others visually by means of modeling. When the literature is reviewed, cooperation inside the clinic, attitude, the friendly attitude of hospital staff toward the student, the positive attitude of staff in patient care, and the presence of positive role model affects clinic education quite positively. During the observational learning, the clinic nurses that the nursing students are mostly communicating and interacting play an important role in the process of their education. This is because the nursing students are focusing on the clinic nurses' behavior and try to retain it in their memories. Then, they will be capable of copying the behavior, for instance, how they react in different situations and how they adapt to the unexpected. With this, The nursing students are able to become professional as the clinic nurses, which means this is a reward for the students since they are modeling the clinic nurses' behavior. That's all from me. Thank you, and let's proceed to Jackson.
Hi, it's me again, Jackson Telongguan. ID number is 75098, and I will be presenting on how the social learning theory approach influence nursing practice. According to Bandura, much of learning occurs by observation, which is by watching another individuals, providing compelling example as a role model on how to think, feel, or act. Learning allows individuals to adapt to demand and changing circumstances, which is crucial in healthcare. As for students gaining information and skills necessary to become a nurse, or for nurses developing more effective approach to educating and treating patients. Most of nursing practice and skills require observation in order for nurses to be able to perform it effectively. For example, nursing assessment such as reading the vital signs, performing personal hygiene on the patients, phlebotomy and other specimen collection, or even interacting with patients. All these skills cannot be effectively learned without observing a role model performing it. Social learning theory consists of three processes, which is observational learning, modeling, and self-efficacy, and all three components affect on the nursing practice. The observational learning consists of four phases, which is attentional, retention, motivational, and reproduction. The first phase, which is attentional phase, is a process where the learner observing the role model that can be lecturers during lectures or lab session, or by observing nurse or another healthcare provider during the practical. The second phase is a retention phase, which the learner try to process and remembering the information they have during the attentional phase. And now we have the motivational phase. The learner need to have a motivation on why they need to imitate the behavior. For example, the learner want to become an excellent nurse and be able to help people, so they will imitate the behavior. And the last phase, which is the reproduction phase, is a process where the learner are able to perform what they have learned during the lab session, exam, or practical. Another process of social learning theory are modeling and self-efficacy process. For the modeling process, a role model is required to demonstrate the behavior so the learner can imitate them. As I mentioned earlier, the role model can be lecturer, nurse, or another healthcare provider. And for the self-efficacy process, the learner need to believe in themselves that they are able to imitate the behavior they learn. That's all from me, as I already conclude my section, and I will now let Ivy to continue her part of this presentation. Thank you.
Hi, my name is Ivy Tawanyi, ID 75080, and I will be presenting about social cognitive theory approach influences patient care. Social cognitive theory emphasizes the importance in observational learning, modeling, and self-efficacy. First, observational learning. This assesses that people can witness and observe a behavior conducted by others and then reproduce those actions. Observational learning can also be explained by watching and observing outcomes of others performing or modeling the desired behavior. Modeling. The behavior must be demonstrated by a role model like a parent, friends, or celebrity. Third will be self-efficacy, the belief that an individual has control over and is able to execute a behavior. Next, I will explain about importance of social cognitive theory. For observational learning, the example is the nurse educated the patient so he had the skills to monitor and interpret changes in his or her symptoms and level of functional status. Second will be modeling. For instance, the nurse promoting the patient's ability to self-model, then advise the patient to implement this plan and monitor his or her symptoms, utilizing a daily log recording his level of exercise tolerance, symptoms, and functional status. Last will be self-efficacy. For example, the nurse encouraged the patient to set his or her own goals that provided internal motivation to succeed rather than goals externally imposed by the nurse. So, in conclusion, social cognitive theory explains how different personal, environmental, and cognitive factors influence human behavior, and it has been an important source of knowledge in the social and health sciences. It has been employed in research and practice in nursing. Hence, healthcare providers can work in partnership with their patients to design tailored, achievable, goal-oriented plans that empower patients to be able to manage and deal with the symptoms they live with on a daily basis. Last but not least, I do hope that you enjoy our presentation and thank you for your support and feedback.